have with us Dr. Amit Das, intensivist from Amri Daguria, and we welcome you to the Natco Pharma Specialty Critical Studio. We look forward to listening to you for some advice to the younger generation of doctors in the space of critical care and those associated with bacterial resistance. What, as per you, are the changes you foresee in the critical care management?
Thank you for the introduction. Critical care is an evolving area of clinical specialty. So, although it is a place where we mainly support the organs and also deal with critically ill patients, one of the major threats in our patients is the sepsis or infection. It can affect the lungs, it can affect the kidneys, it can affect the brain and other organs of the body, which can lead to one or more than one organ failure, and ultimately leading to the death of the patients. So infection was there, is there, and will be there in the future also. But the one should know how to handle or tackle the infections. The major challenge is the growing resistance, the multi-drug resistant among the infections. Uh, Earlier, we used to have these bacteria which were sensitive to simpler antibiotics like ceftriaxone, ampicillin, gentamicin. But as years have progressed, we are facing common the infections that are resistant to different type of antibiotics. Even the higher generation of antibiotics are becoming resistant. So that is the major threat. One should be very judicious, very meticulous while selecting the antibiotic, especially the empirical ones, because you have to keep in mind that when the patient comes to your unit, you have to hit the bug fast and you have to hit it hard. But at the same time, you have to keep in mind about the emerging resistance. So one should be very judicious in antibiotic selection while treating the critically ill patients.
What is your message to the young ICU doctors of today in enhancing patient care?
Stick to your basics. Don't be in a rush to make decisions. Follow your patient's vital parameters. Take a proper history. Take the history of the patient, where he is coming from, what he do, whether he have traveled to any other places in recent say past. But the demographic data is very important, because most of the patients who land up in ICU, they already have a clue in their history regarding the illness they have contracted from outside and which they are presenting with us.
Thank you so much for that insight. What is the prevalence of carbapenems producing bacteria in your practice? And what would you think is the options for treatment?
Over the years, we are seeing a spike in the incidence of carbapenemase production, particularly the E. coli, Klebsiella, these kind of bugs. They have different kind of resistance genes. So in my ICU, uh, every alternate patient, I am seeing there is a rise in carbapenemase production, probably because of the improper and injudicious use of antibiotics over the years.
We have just heard Dr. Amit Das, and we thank you for your time in the studio with us. We wish you all the best in your practice.